Understanding colon cancer, symptoms, diagnosis, and treatment. Colon cancer. Colon cancer, also known as colorectal cancer, is a type of cancer that begins in the colon or rectum. The colon is the longest part of the large intestine, and the rectum is the final portion of the large intestine, connecting the colon to the anus. Colon cancer usually develops from precancerous polyps that grow in the colon or rectum over several years. These polyps can be detected and removed during a colonoscopy before they become cancerous. Symptoms of colon cancer may include changes in bowel habits, such as diarrhea or constipation, blood in the stool, abdominal pain or cramping, unexplained weight loss, and fatigue. However, in the early stages, colon cancer may not cause any symptoms, which is why routine screening is recommended for individuals over the age of 50 or for those with a family history of the disease. Types of colon cancer. There are several types of colon cancer, each of which has unique characteristics and can require different treatment approaches. The main types of colon cancer include 1. Adenocarcinoma. This is the most common type of colon cancer, accounting for around 95% of cases. Adenocarcinomas start in the glandular cells that line the inside of the colon and rectum. 2. Carcinoid tumor. These are rare, slow-growing tumors that usually develop in the appendix, but can also occur in the colon and rectum. 3. Gastrointestinal stromal tumor. These are rare tumors that develop in the connective tissue cells that support the gastrointestinal tract. 4. Lymphoma. This is a rare form of colon cancer that develops in the lymphatic system. 5. Sarcoma. This is a rare type of colon cancer that develops in the muscle or connective tissue of the colon or rectum. It's worth noting that colon cancer can also be classified by the stage of the disease, which refers to how advanced the cancer is and whether it has spread to other parts of the body. The stage of the cancer will help determine the most appropriate treatment approach. Symptoms of colon cancer. Colon cancer may not cause any symptoms in its early stages, but as it grows and spreads, it can cause a range of symptoms, including 1. Changes in bowel habits, such as constipation, diarrhea, or alternating between the two. 2. Blood in the stool, which may appear bright red or dark. 3. Abdominal pain or cramping. 4. A feeling that the bowel does not empty completely. 5. Unexplained weight loss. 6. Fatigue or weakness. 7. Nausea or vomiting. 8. A lump or mass in the abdomen. It's important to note that many of these symptoms can be caused by conditions other than colon cancer, such as hemorrhoids or inflammatory bowel disease. However, if you experience any of these symptoms, especially if they persist or worsen over time, it's important to talk to your healthcare provider for further evaluation and testing. Additionally, routine screening for colon cancer is recommended for individuals over the age of 50 or for those with a family history of the disease, even in the absence of symptoms. Diagnosis of cancer. The diagnosis of colon cancer typically involves several steps, including 1. Medical history and physical exam. Your healthcare provider will ask about your symptoms, medical history, and any family history of colon cancer. They will also perform a physical exam, including a digital rectal exam. 2. Colonoscopy. This is the gold standard test for diagnosing colon cancer. During a colonoscopy, a thin, flexible tube with a camera on the end is inserted into the rectum and guided through the colon. This allows the doctor to view the lining of the colon and rectum and check for any abnormal growths or polyps. If a suspicious growth is found, a biopsy may be taken for further testing. 3. Imaging tests. Imaging tests such as CT scans, MRI, or PET scans may be used to determine the extent of the cancer and whether it has spread to other parts of the body. 4. Blood tests. Blood tests may be done to check for specific markers or substances that can indicate the presence of cancer. Once a diagnosis of colon cancer has been made, additional tests may be done to determine the stage of the cancer and help guide treatment decisions. The stage of the cancer refers to how advanced it is and whether it has spread to other parts of the body. The stage of the cancer will help determine the most appropriate treatment approach. Prognosis of cancer. The prognosis for colon cancer can vary depending on several factors, including the stage of the cancer, the location of the tumor, and the patient's overall health. In general, the earlier colon cancer is detected and treated, the better the prognosis. If the cancer is localized, meaning it has not spread beyond the colon or rectum, the 5-year survival rate is around 90%. If the cancer has spread to nearby lymph nodes, the 5-year survival rate is around 70%, and if it has spread to distant organs or tissues, the 5-year survival rate drops to around 14%. Other factors that can affect the prognosis of colon cancer include the patient's age, overall health, and whether they have any other underlying medical conditions. Additionally, certain genetic mutations can affect the prognosis and may require specialized treatment approaches. It's important to note that these statistics are based on averages and do not reflect the individual circumstances of each patient. Your healthcare provider can provide more information about your specific situation and help guide you through the diagnosis and treatment process.